I think everyone here has joined before as well, so we probably all know each other, but it's nice to do introductions. Balvinder, would you like to come off mute and introduce yourself?
Hi everyone, sorry I'm a bit late. I'm a resident in Merton, wondering what the hell happened to Monday and Tuesday.
I'm joining your club, Balvinder. Thanks for joining us. Barry, would you like to introduce yourself?
Hi everybody, Barry Causer. I work with Una in the public health team.
Thanks, Barry. Heather, would you like to introduce yourself?
Hi, I'm Heather Begg. I'm a commissioner in adult social care, and I work quite closely with Barry and Una in supporting the community response to COVID-19 and oversee other projects within the voluntary sector.
Thank you, Heather. Karen, would you like to introduce yourself?
Hi, my name's Karen. I'm a resident of Merton, and a bit like Balvinder, where's it all going?
This week has been such a short week already, it feels. It's all happening so fast. Serene, would you like to introduce yourself?
Yes, of course. I'm Serene. I am the team lead and frontline trainer from You Merton, which is services commissioned by Public Health Merton, and I work closely with Una and Barry. Thank you.
Thanks, Serene. And hi everyone, you all know me already. Una O'Brien, and I work in the public health team in Merton as well. I think that's everyone. So just a little bit of housekeeping. You can choose to have your camera on or off, but we just ask that you mute your microphone when you're not speaking. As I said already, you can please do use the chat box throughout the session if you have any questions or you'd like to raise any comments. And I will hand you over to Barry, who's going to go through this week's key messages.
Thanks, Una. Thank you, champions, for joining us again this evening. So key messages, champions, we can see there that our 7-day rate has continued to come down over the last week or so. So the 7-day rate per 100,000 residents is now down to about 36.8. So that's about 11 new infections per day in that reporting period, which is about a lag of about a week. As we heard last week, the schools have now opened, so that roadmap has now started. And so, as we discussed last week, any opening up of the measures provides an additional opportunity for virus transmission. So it's a real risk that cases do increase, and we're watching this really, really closely within the public health team. And so we get the data every single day on the number of new infections. And what I can tell you in the last few days, the last 4 days, it appears very small, but the rates are perhaps creeping up. So the last 4 days, the numbers are 11, 13, 20, and 18. So again, it's something we're looking at very, very closely. They're very small numbers and very small increases, but clearly we're going to be looking at the trends of that over the coming days and the coming weeks or so. What I can say, you heard from Elizabeth recently around what the schools are doing to keep schools, their students and their staff safe. On the 8th of March, which was the first day that the schools reopened to all of their students, they delivered 8,666 LFTs across Merton, which is a phenomenal effort by our school staff and students for taking part in that testing. So thank you for those school staff and residents for supporting young people to take part in that testing. So as we have said, really important key messages, champion. It's exactly the same as you've heard me say before. Test and trace is a key part of our approach to keeping us all safe. So anybody with symptoms, even mild, should continue to self-isolate and seek a test from the NHS or call 119. Just like our amazing school staff and our amazing young people that are taking part in regular asymptomatic testing, would strongly encourage frontline carers, staff and volunteers to take part in that regular testing programme. And you can book a test from the Merton Council website. And if you are a household or a bubble of school staff or pupils, that you are able to pick up or get home delivered a box of 7 LFTs that you can take at home to again support the reduction of virus spread. And you can get that from the national government website there. Really important that all residents that have had their vaccination continue to follow the rules and the guidance, so hands, face, space. And if they have symptoms, again, however mild, please isolate and get tested. And also to continue to take part in regular asymptomatic testing. These devices are important to us, so I'd encourage you to do that. NHS colleagues, I'm just having a quick look down the list, are not here tonight, but they're doing an amazing job to continue the vaccine rollout. They're now vaccinating the over 50s and those that are high risk or moderate risk. And I guess it's really important again that if you've previously declined the vaccination, it's never too late to book an appointment. So if you are eligible, you can still go back if you have changed your mind to get that vaccination. Final key message, champions. I know you are incredibly well read. You look at the news, you look at the stories and the articles behind it. You will know quite clearly that there's lots in the press about the AZ vaccine, with some countries pausing the use of that AZ vaccine. This is related to a number of blood clots that have been reported by those that have had the vaccine. Important to say that blood clots are not uncommon. And the evidence does suggest that the number of blood clots is no higher than would have occurred naturally. So the key question that the scientists are looking at is causal. Is it causal, or is it just a coincidence that the number of blood clots have occurred during that population that have been vaccinated? And we think it's coincidence at this stage. So there's no evidence of that. So the MHRA, the World Health Organization, and the European Medicines Agency are all recommending the continued use of the AZ vaccine. So we would encourage you to take part in the vaccination program if and when you are invited to do so. There will be additional evidence and reports published tomorrow on this, but we're not expecting that to be any different from what I've just kind of give you a very brief update on this evening. So thank you again, champions, for listening, and I'll hand back to Una to move on the agenda.
Thanks, Barry. If anyone has any questions on any of the key messages, please do put them in the chat box or raise them in Champions Corner. I'm going to hand you over to Serene, who's going to talk us through some of the great work You Merton are doing.
Thank you. Thank you very much, Una. Well, our services, as you all know, this is health promotion services, and I will start by saying that our website includes all aspects of health promotion services. So from healthy eating, physical activity, reducing alcohol, and stop smoking. From this, you will be having all apps at each service that we are providing. So there are 2 apps for healthy eating, 2 apps for physical activity, 3 apps for stop smoking, and 2 apps for reducing alcohol. That's in case you would like to do all on supporting yourself by yourself. If you would like support from our health advisor, we have 2 different kinds. So this is another arm of our services that coming out of our website. This is the services that we deliver virtually or over the phone according to the request of the client. So we have stop smoking services, and we have 3 stop smoking advisor and specialists, and we have also 3 other health advisor who supports people who would like to change their lifestyles, being more healthier, like having more activity, reducing their alcohol, or having healthy eating, and they will be supporting them in all these aspects. The second thing that we are delivering also is training. We have introduced a new training. We used to introduce health champion training, but now we have introduced mental health awareness training. I think because of the need for mental health awareness during the pandemic period. Both of them are training that accredited by Royal Society of Public Health, and attending 7 hours of this training. Both of them, or any one of them, you will be awarded by a certificate from Royal Society of Public Health, and either mental health awareness or improvement of health improvement, both of them from Royal Society. The last one that I would like also to mention and raise awareness about, we are delivering many sessions around health promotion, around physical activity, around healthy eating and mental well-being. We deliver this session according to either as a webinar, open session, or as in collaboration with other organizations in Merton. And sometimes in this session, it will be specifically to the attendance of this organization. So for instance, we will be having a physical activity session next week on 25, which is delivered for WDP. And we will be delivering also another mental health awareness session for Sunshine Cafe attendance and the clients. On the other hand, we will be doing a webinar which is open to the public, and we are doing also work and session with the other organizations like we are doing next week. We are doing on the 22nd of March. We are having mental well-being and mental well-being matters with Health Watch Merton. And we are having also another session early April, on the 7th of April, on the 8th of April, we are having Managing Anger with Merton Uplift. We also, the other one that we are having, which is open to the public, is about healthy living, healthy lifestyle. And this is according with the 7th of April, which is the World Health Day. So we are doing that with Merton Libraries. We will be delivering a webinar before Ramadan, and we'll be talking about healthy eating and webinar. So these are different type of sessions and webinar that we will be delivering, and it is available on our social media if you would like to check, and also on the partner worker, whoever organization. So it will be on Merton Health Watch, on Merton Uplift, and on Sunshine Cafe if you want to check, and also on Merton Library. The admission, if you would like to attend, you can just click on and book a place to you. And in addition to that, referral to us is easy. There is an email address that you can find it there. If you can also access our website and refer yourself accordingly. You can email us or you can call us. So please do, if you have any query, I will be happy to answer you. Thank you.
Thanks, Serene. That's really helpful. And I shared some of the upcoming webinars with everyone last Friday. But once Serene provides me the information as well with the any more webinars, I'll share those with you all so you can attend.
I will be. Thank you.
Thanks, Serene. Does anyone have any questions? I'm just looking in the chat box. I saw Karen, you had a question.
Yeah, the first one was about the LFTs. Are all secondary schools actually participating in the LFT programme, or have some declined?
Hi, Karen. Good question. Yeah, all the schools are participating. It's up to individuals to decide whether they participate in the programme. Clearly, they've now been delivered. I've got the data for about a week, and we're looking at that really closely. But a fabulous effort of over 8,000 on that first day. So we're going to watch it. We're going to looking at it really closely because we know swabbing's not particularly pleasant, is it? But they are doing it to keep the schools safe. So I'm delighted with their work.
I just wondered if there was some kind of hard to reach, maybe groups and parents who were not willing to do the tests.
No, we've got the data so far, which is very general, but we're going to start to delve into that a little bit deeper to understand what's going on. And across Merton, let me get the figures right. Last week there was about 28,000 LFTs, and 16 of them, 16, were positive. So a 0.1% positivity rate. So again, that's 16 people that would not have been picked up that would be transmitting the virus. So again, thank you for your efforts.
And the only other thing, which again, I think Bavinda mentioned as well, the Optimal Aging Project seems like a good fit for You Merton. And we talked about how sometimes there's too much. There was a guy at the meeting that they were at who pointed out there's a lot of this stuff going on, and what you want to do is really connect to all of that, link it. And I wondered if You Merton was in touch with the Optimal Ageing Project, because they are short of people, they need some people, and I think it would be good. We're all covering similar areas, and they're trying to do research, which I think is really useful.
Thank you, Karen. Yes, we have contacted them and we are trying to work in collaboration with them. I have already, since the last time when they present the project, immediately after that, I contacted them and requested that we will be supporting them, and we are raising awareness between our clients to get involved within the groups that they are delivering services to. Yes, focus group. Yeah, thank you.
Is there a time that's better? Because it seems to me they do daytimes, and the take-up seems quite low. And I wondered, for your kind of cohort of people, would daytime or evening be better?
Well, we are still gathering them, so I think daytime will be much better. But then for working people, maybe nighttime will be better. But there are different sessions, so they have the choice to attend whatever session they would like to attend. I think there are 6 sessions for each one of them. They have a 3 session with one and the 3 session with the other one. So there are a few options for them to attend, which we will be giving them that. Yes.
No, that's a really important point, Karen. And the Optimal Ageing team are doing a mapping exercise, and they're trying to link in with existing services in the borough to make sure that they're not replicating any services, but also joining up that working as well. So that's a really important point. Yeah, and I think Beck raised it last week as well about the sustainability of the project in terms of ensuring that once you start something that it's able to continue, and that we have those links in from other groups. So that's a really good point. I'm just checking the chat box. Sorry, Barry, you raised your hand.
Yeah, thanks, Una. While you're just having a check through that box, maybe I can bring Vasa into the conversation. So Vasa, I've kind of explained to the champions that some European countries had paused the use of the AZ vaccine. Had a very, very brief description of kind of that causal versus coincidence, but yes, perhaps you could share with the champions your perspective as well, please.
Yeah, I think it all swings on that word causation and coincidence. So I say take a step back. We have given 25 million doses in the United Kingdom. We can easily say at least half of that, nearly half of that. So let's not even say 12 million, let's say 10 million has been AstraZeneca. Now, we have not seen that increased clot occurrences in UK. So we can safely say that we haven't noticed those numbers. Then you have to ask the question, why? What's going on here? Then we come to the point that clot is a naturally occurring phenomena in people. As I said in meetings before, it happens more in women than in men. It happens more in pregnant women than in non-pregnant women. It happens in certain conditions. It happens after certain operations. So clot happens regardless of whether we have the vaccine in place or not. So what we are looking for is are there more clots happening than naturally occurring, normally naturally occurring number of clots? And the United Kingdom data doesn't support that. So the best thing about the UK is that in UK, you don't rely on me reporting your clot. So if I give you a vaccine and you develop clot, you as a citizen can report it yourself. So our data is very good because it's not purely clinically driven. Our data is clinicians plus citizen driven data. So I have real confidence that because we have not seen this increased number over and above what we normally get in the UK, that we can't attribute this to causation. So if it's not causation, then it's the other word, coincidence. Sadly, I don't know the word for causation and coincidence in French and German, then I would have explained it to them as well. But I stick to English. I know what causation in English means. I know what coincidence in English means. So let's be happy. So far, MHRA in England has said they don't think this is causation. Equally important, the European Medicine Agency, which is the counterpart for MHRA in Europe, has also said that they don't have any robust evidence to say this is causation. So we are sticking to coincidence, and I am fairly confident because based on the 10 million plus we are given here, if something is going to happen, it would have happened in the 10 million. In 1,000 or 10,000, one could say, oh, it might happen. Once you do 10 million people, then your data is pretty solid. After that, the chances of it happening are so low. So it comes back to the third word, causation, coincidence. The third word is chance. The chance of dying of COVID in an unimmunized person is going to be greater by a big margin than the chance of a clot, even if it came, because we have the 10 million who already had it. So we can be very, very confident to reassure people based on the three words: coincidence, causation. That's it, really. Yeah, that's what it is. And the chance, okay? The
Thank you,
chance of
Vasa.
happening so low.
Thank you, Vasa. Aziza, you had a question as well on vaccines. Would you like to come off mute and ask Vasa?
Hello, Vasa. Sorry.
Yes, hello.
I'm just referring to the news that was on probably half an hour before this meeting, where the government was saying the NHS has received a letter that there may be some issues with the number of vaccines available.
Sorry, I'm not kept up with the news. As you can see, I'm still in my office at work, but I will check it up when I get a chance to look at it. So
I just wondered, what I've had my first vaccine, which was a Pfizer. I'm just wondering, is it likely the second will be delayed?
I can see where you're coming from, because you're worried that if there is a supply problem, would you get your second dose? So I'll tell you, see, the best thing about living in the UK is that you can actually predict the way UK deals with any, shall we say, setbacks. So based on what UK did in January, I can safely predict we are so cohort focused here, because cohorts leads to mortality. Okay, so I can easily predict that if ever there was going to be a problem, the decision would be, please give the second dose to those who are in the high risk, then give the first dose to those who are in the low risk. Follow me? Logic.
Yes.
England is a logical country. That's why I say it's a predictable country. So the same logic which applied in January was to save lives by targeting the cohort. If ever there is a problem in supply, we will go back to the same logic, because it goes back to our morals, our values. Our values are, if you can save a life, go save it, right? So if you want to go on the same principle, properly immunizing a high-risk person is going to be more effective in the long term on the death and destruction caused by. It's not only life, it's also destruction, okay? High risk. The thing is about the vaccine reduces severe disease and death. Therefore, I would expect England to go to the same logic as we had during Christmas to say, save the life. Second dose to the high risk, far more important than first dose to a low risk. The first dose guys may get cross with me, but that is part of being in leadership, that you think things through logically, but also you have a logical framework of thinking where, as I keep saying for the 100th time, we will always try to save a life wherever we can in the NHS. That is fundamental principle for us. So don't worry, even if there's a little bit of a problem, we will not forget you. Of course, we can only give what we have, but we will prioritize it logically.
Thank you, Vasa. And I'll say that to my mother as well.
Yes. I say, go back to you. We live in a very rational country, which has got values and which has got principles and which has frameworks, and we follow it. And these are clinically driven decisions. So that is why I, as a clinician, can freely talk about these things, because it's nothing to do with politics. This is pure clinical, medical, ethical, value-based principles.
Thank you.
Thank you, Vasa. Does anyone have any more questions before we move on? No? Perfect. I will hand you over to Heather, who's going to go through the community response and emergency assistance, and we'll have time for Q&A as well after this.
Good evening, everyone. So it's actually just me presenting this evening, but this afternoon at the Community Champions, we did have Susie Rollins from the Welfare Benefits team attend as well. Next slide, please, Una. So a year of COVID-19 and the impact. I just thought I'd just kind of put some pictures together to demonstrate, you know, the impact. And obviously it's had an impact on all of us, and we've all had to make changes in the way we shop, the way we exercise, the way we work, and the way we connect with friends and family. But there's others who are obviously more isolated in Merton, and there's been and have needed to shield, and some people have been shielding for a very long time, and they've required a bit of additional support with practical tasks, such as collecting of medicines, shopping, help to staying independent, and keeping in touch. For some people, there's been other impacts as a direct result of having COVID, not being able to connect with family and friends, which has had a significant impact on people's well-being. There's been an impact on people's physical health as well. And then for some people in Merton, the government restrictions have obviously had a significant impact on their employment, their financial situation, their housing situation. And we are now seeing a real increase in need due to the changes in people's economic circumstances. Next slide, Una. So this time last year, we kind of saw what was happening with government guidance, but we felt that what we needed to do was provide a response to some of the impact of COVID-19 on our communities locally. And the really good thing in Merton is that our voluntary sector are used to working together in partnership with the council and the CCG. So this was quite easy for us in Merton to bring people together to provide a community response to our most vulnerable residents as a result of COVID-19. So we joined together a number of organisations. We joined together a community response hub, so it was a telephone and email line that people could contact if they needed support, and support in a variety of different ways as well. So it may have been practical support, but again, all of those areas that we've just talked about, people could receive support or provide a route to the support that people needed help with. So we have the Community Response Hub, which is a partnership between Wimbledon Guild, Age UK and MVSC, where actually the council have actually decided to go out to tender for that service, and we're currently going through that process now, because in Merton we recognise that this support is going to continue to be needed almost now more than ever. It's just that maybe the needs have changed slightly. We've also got the Community Fridge Network that's part of the community response, and this is a longer term initiative to tackle food poverty and reduce food waste in the borough. And that's a partnership between Sustainable Merton, Polish Family Association, Wimbledon Guild and Commonside Trust, who are working with the Felix project, who are part of the London Food Alliance, which is about the redistribution of surplus food, and Merton Community Transport. We've also got a number of other strategic partners, including Carer Support Merton, Merton Mencap, Merton Vision, BAME Voice, Merton and Malden Guild. We're also working with Merton Mutual Aid, and we actually started working with Mutual Aid on the day that they were set up, which was a fantastic partnership arrangement. And of course the Dons. We wouldn't have been able to support people in the way we have in Merton without the fantastic support of the Dons Local Action Group, which has been providing significant emergency and crisis assistance since the start of the pandemic. All of these organisations meet on a regular basis, so they meet on a monthly basis and work together that Merton residents are supported. And we welcome other community organisations to join this network. So this is not an exhaustive list. There are lots of other community organisations supporting their communities and their residents, but these are the ones that are being a bit more structured in their approach by working together. Next slide, Una. So this just gives you a flavour of the number of organisations who are part of the food response network in Merton. So that includes the food banks. So organisations that deliver food parcels. Again, this isn't an exhaustive list because somebody mentioned another organisation on the community champion call this afternoon. It was like, right, we need to connect them in. So, you know, again, this is changing all of the time and evolving as well. We've also got the community fridge network up there. Again, it's different types of support. Some organisations provide crisis support for a limited period of time or a number of food parcels, limited number of food parcels, but the community fridge works slightly different because it's surplus provision, it's ongoing support. And then there's practical volunteer support. There's a number of organisations providing regular practical volunteer support to those who are isolated or isolating, self-isolating, or are shielding. And the local authority has a responsibility to ensure that people who are shielding locally are provided with the right support. And we did have around 6,000 in January, and we now, because there's changes, we now have 13,000 people in Merton that have been advised to shield, and they all have the contact details of the community response hub. And you know, some people do regularly contact the community support hub for help and assistance. We've also got hot meals provision services in Merton. So some of our most vulnerable residents who would normally rely on other services, such as lunch clubs or accessing community activities and day centres, we do have hot meals provision provided to those vulnerable residents. Again, as I said, this is not an exhaustive list, and there's many other community, neighbourhood and faith groups supporting their communities, but these are the ones that we're classing under the community response network. Next slide, please, Una. So this is just giving you a flavour of Merton's community fridge network, and since they started, how many families are benefiting from that support. And how many meals have been delivered. So it's just giving you a flavour and a snapshot. One of the things we are doing at the moment is we're having a review. So we're reviewing all of the support that organisations have provided over the last year to help us identify where the need is in Merton, to make sure that we've got some sustainable plans in the future to support people, because as we know, the need is, you know, for emergency assistance is going up. Next slide, Una. One of the initiatives, again, this is just an example of a local initiative, is that we have a number of organisations that are BAME-led who are working together to support their local communities. And it's hoped that when the Taylor Road Togetherness Centre opens, and that's just north of Mitcham on the border of Tooting, that should be open very soon, that centre, and these organisations will all work collectively to provide support to their communities. And again, that will link to the wider community response network. Next slide, Una. So in terms of emergency assistance, there are some schemes in place within the local authority that just wanted to highlight to you. Some of you may know about these already, but there is support for people with their council tax. There are test and trace support payments that people can access as well. And we've always had this welfare benefit service. It's been a long time service for people to actually have a welfare benefits check to ensure that everybody is getting what they're entitled to. And again, that's mainly over the telephone and email, but Susie Rowlands, who oversees that service, who was attending the Community Champions earlier, you know, did say that they are working hard to explore other ways to make sure that that service is accessible as possible. And there's also the local welfare support scheme. So we have a local fund in Merton. It's a limited fund to support our most vulnerable Merton residents with short-term severe financial difficulties. So that will be a short-term grant, so a one-off grant to support people who are in real financial hardship. Now, one of the things that Susie did say earlier today is that it's better if people before their appointments make sure that they have all of their documents that they need for these appointments ready, because that will then speed up the process. Because there was a comment earlier that sometimes there can be a delay to get in payments. But I think Susie said that payments for the local welfare support scheme can be made on the day, but other support, for example, the test and trace support payments are normally within 3 to 7 days. But if people have all of their documentation, that can speed up the process. Next slide, please, Una. We've also provided additional funds throughout this pandemic to Wimbledon Guild, and Wimbledon Guild have a one-off individual grant scheme. And their grants team can provide small grants available for a number of different things for emergency assistance. And we've also got the Warm and Well project, which I believe you've covered in the Community Champions in the past. It's a really good initiative, and people can access small grants through that as well. But the really good thing about that service is that it's giving that short-term assistance, but also that longer-term support that people might need to look at how actually they can make efficiencies with their energy suppliers, and actually access to larger grants for necessary home improvements. And there's also a free handy person service for eligible residents linked to that as well. And information and advice. So there's a lot involved in that project that people can access. But if people aren't sure, they can always contact the grants team and they will explain the process. But it's very much a needed service, and there will be grants available via that service for the foreseeable future. Next slide, please, Una. We're really fortunate in Merton, actually, that we've really got a rich and vibrant voluntary sector, and there are many organisations in Merton that provide information and advice that could support residents who need emergency assistance. So I've just listed a few there, including Citizens Advice, Polish Family Association, Age UK, Deaf Plus. Some people would prefer to go to an organisation that they feel more confident with, and that's the beauty of working as a partnership and a collaboration, that we can all support each other and help people access the services they need rather than just signposting, because sometimes it takes a lot for people to actually pick up the phone and request help. And we understand that as well. So we want to make sure we can, make it as easy as possible for people. Next slide, please, Una. So all of the services and the organisations that I've talked about today and the services that they provide can be accessed through the Merton COVID-19 Community Response Hub. So people, all they need to do is pick up that, call that number, or email that, help@mvsc.co.uk, and they will receive, somebody will answer the call. That's Monday to Friday, 10 till 4. Have a conversation with somebody, help understand what kind of support they need, and then we'll direct them to the organisation or the support that person needs. If people need emergency assistance, so if they do need an emergency food parcel, that can be organised for that person pretty much that same day, or certainly within 24 hours, and that will be organised straight away for that person. But the whole idea about the Community Response Hub is to give people emergency assistance, but then actually work with that person to look at what some of the more short-term or longer-term options of support are. Next slide, Una, please. So to support the community response, we've developed a number of fact sheets around different areas, and these can all be accessed on the MVSC website. So they're not the prettiest of fact sheets, but they're very much for organisations to use if they're supporting individuals and residents. But again, residents can access this information as well. It's just that they are just Word documents with lists which include referral pathways, a bit more detail about the services. So there's 8 fact sheets in all, around wellbeing support, supporting families, financial hardship, supermarkets and food provision, voluntary services offer in Merton, and access to medication during COVID-19. So we try to keep these as up to date as possible, and we know that some organisations, because of the way they're working, have struggled to keep their websites up to date at the moment. So this is where people can go to access support and information. Okay, I think the last slide has got my contact details, but are there any comments or questions?
Serene, you have your hand up.
Yes,
Hi,
thank you
Serene.
very much, Heather. Just one thing, I noticed that you are working, of course, with Merton Muslim Women, and I'm sure with other Merton Muslim organizations. But as Ramadan is coming up, so is there any provision that is tailored to the need of the Muslim community?
So I'm sure there is, but I'm not necessarily the person to ask. But I can go back and I will find out for you, Syrian.
Yeah.
I think I have to accept my limitations, because
Okay.
there is so much on offer for people.
Yeah.
And I think what we try to do with the network is kind of say, do you know what? We don't necessarily know, but we know who will.
Okay.
And that's the whole beauty about the Community Response Hub. You know, we work as this network because we all know we've all got different skills and experience, but definitely that's something I can take back and Una can share on Friday.
Good, thank you.
Yeah.
Just in case someone will ask us, so that we can signpost them to wherever they need to go according to your advice. Thank you.
Absolutely. Thanks, Syrian.
Thanks, Serene. That was a really good question. And I see Aziza's hand is up as well. Aziza, do you want to? Is this a different question, or are you?
No, I'm butting in, Una.
No, I thought you might, and I was hoping you would.
Sorry, Serene, we used to, when we were meeting face to face, we used to get a GP from the British from the British Medical Islamic Association to come along and do talks. They're very good. And they bring a lot of leaflets as well about Ramadan.
Well, thank you, Aziza. What I was requesting is there is a need for maybe food and extra things that maybe the community hub will be in assistance with Muslim community at the time of Ramadan. So
sorry. Okay.
Yeah, I was asking about that. Yeah,
and I think that's a really good point, and which is why you know, the BAME collective of organisations is really important to us as well, because you know, whilst people do what they can to make the ambient food parcels you know, appropriate for individuals, they're not as maybe culturally sensitive as they need to be. So that's why we're really encouraged by those organisations working together and coming to us. And what's really good about these organisations working together is if there is a surplus, and then there is a gap in provision, so a gap in need, you know, they work together, and there's provision delivered across the borough to supplement you know, the provision that is given.
Yes,
So
yes.
which is really good.
This
But yeah,
is
we're
great, yeah.
very mindful that actually people's dietary requirements, you know, certain cultural requirements do need to be adhered to.
Good. Thank you. Thank you.
Thanks, Heather. Thanks, Serene. Vasa, you have your hand up.
Yes, I want to say yes. We in Merton, some of our doctors too can be of value to you, because we know of the Islamic Medical Association because they have done some very good work on COVID in particular. Their doctors have produced a lot of wonderful leaflets dealing with the Ramadan and COVID vaccine and stuff like that. I'm no expert on the topic, but anyone wants to look at what they say, it's available freely on the website. And they have provided good guidance on COVID. They don't sit on the fence. They just come around saying the fundamental. I listened to one of their talks, and the sheikh was very clear. Suleiman Ghani in Croydon, he said your fundamental requirement according to scripture is to save a life. And therefore, when you take a vaccine, you save a life. That's it, full stop. He didn't go to talk 10 sentences. 2 sentences, he finished the debate by saying, save a life, take the vaccine. That's simple. And that's why I like the message from him. But I'm no expert on the topic. But yes, if anyone wants to get in touch, we can work and get you in touch with the Islamic Medical Association website. And rather than listening from me third hand, obviously it's not my faith, so I can't profess to know what the scripture said. I'm only quoting what he said. It said. So if you want to hear directly, we can put you in touch with the website, or even other doctors from the same faith who probably will convince you more than I can convince you on these topics.
Thank you very much. Thank you very much, Dr. Vasa. We are in contact with the Muslim International Community Organization in Merton and in London also. So we are in contact with them. Thank you.
Thank you.
Thanks, Vasa. And actually, Aziza, one of our champions here this evening, has shared a video with me from the British Islamic Association as well. I think it's a similar video to the one you were just speaking about, Vasa, and it was really, really great. And we shared it with all our champions in the WhatsApp group. So I'll send out the link to the website as well in our email on Friday. Does anyone have any more questions? Serene, your hand's up.
I just would like to add to what you have mentioned. There was a webinar today on Ramadan, and one of the sheikh in East London and a consultant in diabetes. So he also mentioned that, and there is a presentation slides and a video will be sent to us. If you would like, I can forward it to you once it will be getting to me. So it has good information about fasting and diabetes. Thank you.
That would be brilliant. Thank you, Serene. Heather, I have a question for you. How can organizations who are not already involved in this network get involved? Is there an easy, do they contact you, or do they go via?
They can contact me. You know, I'm more than happy. You know, the thing is, this network is definitely not exclusive, and it's changing and merging all the time. And like, for example, we had a meeting yesterday, and Una, you were part of that meeting with our voluntary sector partners, and we're talking about trends, we're talking about issues, and do we have the right support available for our residents locally? So these things are talked about and discussed on a regular basis. And again, I think, you know, the more partners who are providing that emergency and practical support and assistance that can get involved in that conversation, the more informed we are, so then we can respond accordingly. And things, as I said, things are changing. You know, what people are needing support with now are changing, and that is a result of the impact of, you know, you know, a year later and the situation we're in now. I think the key thing is that it's fantastic that we've got the vaccine rollout, and I'm so proud to be in Merton, because it has just been absolutely amazing. And I'd like to congratulate all of the, you know, all of the health professionals that are involved in that. but the economic circumstances of some of our residents is really quite severe. So we need to be really, and also the well-being of our residents as well. So there's all of these impacts. We really do need to think very carefully and be considered about what support. And I'm very pleased that we've got the Community Response Hub will continue, certainly for, we're looking at that contract starting in June this year. So that will be June to May next year. So it will continue all the way up to June, and then a new contract. So we're going to have this support for another year and a half, which is really good.
That's fantastic. Thank you, Heather. And it is really reassuring to know of all the great work the Community Response Hub is doing in helping people who are at their most vulnerable at the moment. So thank you for providing that great overview.
Pleasure.
Does anyone have any more questions for Heather?
Yes.
No.
Here.
Oh, Zara, perfect.
Yes, sorry, I can't write a message. It doesn't. Yeah, I just wanted to know if all the support services provided are mean tested or not.
So some of the emergency assistance is means tested. So, but you'll need to look at the detail. So you'll need to look at the detail, or just make a phone call, and people will go through the specific criteria.
Right.
So it's to make sure that the resources go to the people in most need. However, in terms of the Community Response Hub and emergency assistance in terms of food parcel, no, that isn't.
Okay, no, thank you.
Thank you, Zara. Has anyone any more questions for Heather? No. Well, just before we go, just an update. We have a man that usually attends in the afternoon sessions, the champion sessions, and provide update on the vaccination rollout. She's done that before. And Aman leads on the community engagement, and herself and Vasa have delivered several vaccination sessions where people can answer questions. And today we went to Faith in Action, and we had a couple of service users there who were hesitant about having the vaccine before, and after being able to ask some questions and have them answered, we had one person who said that they would definitely attend and get their vaccination. So just thought I'd share some good news with you all this evening. And if you know of any particular groups that you think might benefit from being able to ask some questions, please do let me know, because we'll be very happy to attend and deliver a session on the vaccinations and also testing and kind of a whole COVID package. So do let us know. More than happy to attend. Vasa, your hand is up.
Yes, but also do let us know if you want it in a language even other than English. We have an army of healthcare workers. Obviously, you can guess it from the people you see when you see a healthcare worker. In London in particular, I don't think there's a language which is not spoken by anybody where we can't find a healthcare worker. One problem, my Tamil is not brilliant, so I do get told off when I try to speak Tamil, but I can find a better Tamil speaking doctor than I am.
Yeah, thank you, Vasa. That's a really important point. And our session today was in Polish as well, and we had Dr. Marek deliver the session, which was brilliant. So yes, any languages, let us know. We will make sure that we can deliver it. So thank you. And I guess next steps, I will pull together all the questions asked this evening and answer them, share them in the Friday email. Our next drop-in session is the 24th of March, so the same times, 12 to 1 and 7 to 8. We just ask that you share the key messages with your family, friends, your networks, your communities, and if you know of anyone that would like to be a champion, please do send them our way. If you have any questions at all, please do just pop me an email during the week, and I'll share it as well on Friday as well. So thank you all for joining us this evening. Thanks, Heather, Serene, and Vasa. Again, thank you all. Have a lovely evening.
And
Thank
you,
you.
Una. Thank
Take
you.
care. Bye-bye.
Bye.
Bye-bye.
Bye.